Okay, well, let's go ahead and get started this afternoon. Again, I'm really grateful everybody wanted to join this afternoon and talk some more in our series about the new era of Medicaid and how we're working hard to make Medicaid work for you as dental providers. My name's Tanya Dorfbrunner. I'm the Executive Director here at Oral Health Kansas, and really, again, happy to welcome you to our webinar today. I'm going to start by just reminding you of our series. This is the third in a 7-part series of webinars. We are trying to share just every aspect of the Medicaid program so that you feel comfortable and understand how everything works. Today, we're really excited because we're joined by representatives from all 3 of the Medicaid managed care organizations. We've got folks from Sunflower Health Plan, Healthy Blue, and United Healthcare, and you'll get to meet all of them here in a few minutes, and we're excited to have them and have you get to meet all of them. I want to just kind of also begin by thanking the KDA, the Kansas Dental Association, and Oral Health Kansas are co-sponsoring this series. It is funded by the KDHE Division of Healthcare Finance through an ARPA grant. That's where the funding for this comes from. Kevin, I don't know if you want to hop on and say anything to welcome everybody here. Oh, Kevin, you're muted. It's the
My
world
first
of Zoom.
Zoom ever. Thanks, Tanya. Appreciate the opportunity to welcome the participants on behalf of the Kansas Dental Association. Very pleased that you're able to join us today, and hope that your office either will learn more about how to better provide Medicaid to the many citizens in Kansas that need it, or if you're just exploring that opportunity to perhaps become a Medicaid provider. We certainly hope that you'll take that into serious consideration with your office and move forward. So again, thank you very much.
Thanks, Kevin. Great lesson. We all have your muted thing happen all the time. So let's talk, just speaking of muted, let's talk about a few logistics here before we hop into today's content. If you've been with us the last few weeks, you'll know these are kind of what you've seen before, but just as a reminder, we're going to use the Q&A box for questions today. So if questions come up throughout this presentation, please put those questions in the Q&A box. We'll get to as many questions as we can. We've mentioned in the past too, we've been collecting questions from the series. We're going to publish a frequently asked questions document at the end, so you'll be able to take a look at that. And I do tell you, if we have a question today we can't answer, we're going to do our very best to research that and get you the answer right back as soon as we can. If any technical problems or questions come up, please either use the chat or you can email us at the email address you see on the screen. And as a reminder, there's 3.5 dental CEs available if you participate in the whole series. It's but a half an hour CE per session. So depending on the number you participate in, that's how many CEs you would have. So I think some of them are already doing that, but do put your name and email address in the chat just so we know that you are looking for those. And as a reminder, we will be posting the recordings and the slides on our website. We've had a little bit of a technical issue and we haven't gotten those up yet for the first 2 weeks. I think we'll be able to get them all up this week. So bear with us as we work through those technical challenges, and we'll get those out as soon as we can. Well, let's just talk a little bit about why we're here. So this is all part of this webinar series is all part of the Pathways to Oral Health initiative, which is a multi-stakeholder initiative focused on 3 things: focused on providing support for dental offices and being successful Medicaid providers, focusing on educational programs for both dental professionals such as this and for people with disabilities, and then focusing on communications tools to help break down barriers, specifically about the My Dental Care Passport we'll talk about here in a few weeks. I mentioned it's a multi-stakeholder group, so this just gives you a sense of the number of organizations involved in this project. You can see, of course, Oral Health Kansas and the Kansas Dental Association, Community Care Network of Kansas, all of the MCOs, and many other partners, including several universities. Just got great support with this group, and happy to be able to work with this great group of colleagues. So with that, I think we're going to be ready to hop into our agenda this afternoon. As you can see, the agenda, we're going to talk just briefly about what Medicaid managed care in Kansas looks like. And then we will welcome our partners from Sunflower Health Plan, Healthy Blue, and United Healthcare. If we have time, we'll get to several resources as well. So I think with that, Brian, I'm going to introduce you. Brian Thompson is our dental Medicaid facilitator, and he's going to start us out talking about Medicaid managed care.
Thank you very much, Tanya. Medicaid managed care began in Kansas in 2013. Prior to that time, it was a strictly fee-for-service program administered by the state of Kansas. It does include all Medicaid services such as medical and dental care, and all Medicaid populations such as children, older adults, people with disabilities, and pregnant women. So under managed care, instead of the state paying medical and dental providers directly, CanCare contracts with private insurance companies called managed care organizations, or MCOs, to manage people's care. Members choose or are assigned to one MCO and get the care they need from providers in that MCO's network. The state pays the MCO a fixed amount per member each month. In exchange, the MCO must provide all covered services the member needs, including dental. For dental care, the MCOs subcontract with vendors or dental benefit managers, as you see in the graphic. These vendors then work with dental providers. So while CanCare is a state program, the MCOs and their vendors are the ones who manage the day-to-day dental benefits and connect members with dental providers. So you'll see on the next slide here, these are the 3 managed care organizations in Kansas. Today, we're going to hear from all 3 and learn how they can support your office. So first up is Sunflower. Eric Rolls represents Centene, the parent corporation. So take it away, Eric.
Thank you. Hello. So as he said, my name is Eric Rolls. I'm the provider relations representative for Centene Dental. And so I'm going to talk just briefly today about how we support you. And I think I'll get to come back in a few weeks and talk a little bit more in depth about the plan. But today, my main goal is to let you know that if you choose to join, you're going to have a lot of support from Sunflower. So you're never going to do it alone. So again, we are Centene, and our members, when they come to your office, they're going to hand you a card that says Sunflower, and that's the name we brand in Kansas. So let's go to the next slide, and we'll talk just a little bit about provider resources we have for you. So the best resource I have, one of many, is our website, which is centenedental.com. And so you can go there right now after the presentation, and there's a lot of things on the public side of the website that you can access right now. And then there's more features if you choose to contract that you can access after you join. So today you could go there right now and look at the CDT code lookup. I think that's where I try to drive most providers, because you could run a hypothetical treatment plan through it and see, are my codes covered? Are there any limitations? Does it need a prior authorization? And then if it does need a prior authorization, you're going to see the clinical criteria. So you'll know what my dentist is looking at when he or she is determining that. So again, there's that on our website. There's provider manuals, there's sample IDs. So all that's available right now. And then if you choose to join, you'll want to register for our website, and you can submit claims, submit authorizations, check eligibility, and review remittance advices all on our website. So there's that. So let's go to the next slide, please. But that's not all. Of course, we do post a quarterly newsletter on our website, which just gives you, comings and goings of Centene. My team, which is the provider relations representative, we do biannual webinars. And if you happen to miss it, that is okay, because we're going to post it online. And that webinar is just kind of going over the website and the plan in detail. It's about 30 minutes. It's a good overview if you've never done it. So if you don't happen to see it this year, you can still see it on our website. We have 2 provider relations representatives in Kansas. I am one. My partner, Tiffany, is the other. And you'll get my email on the next slide. And so you can reach out, email us anytime, and we'll get back to you as soon as we can. So you'll have a working relationship with us. And then we also, of course, do have customer service, so you can call them for any quick questions. But you can also email us, and there's a contact us feature on the website that'll also reach out. So you'll always have a person to talk to. It'll never be just a call queue. And so reach out anytime. And we want to support you because we want you to do well in the program. And then, of course, there is the customer service number below. Like I said, that's for quick questions, and it also works to check eligibility. All right. Well, and like I said, I just got a few minutes today. And last on the next slide is all my contact information. So my team email is dentalproviderrelations@centene.com. Just put your state, your tax ID, and any question. It'll get routed to me or Tiffany, and we'll get back to you as soon as we can. And then our other teams are also listed, the credentialing team, the network team, that's if you're a new provider and are ready to contract. But like I said, if you're not sure, please reach out to us. We'd love to hear from you, even if you're not a provider yet, just to give you the best information so you can determine if we're a good fit for you. And I certainly hope you are. So that's all I have today, and I'll look forward to speaking with you all in a few weeks. And thank you.
Thanks, Eric.
Thank you.
Next, we turn to Healthy Blue. Dr. Frank Varon is their state dental director. You're up, Dr. Varon.
Good afternoon, everybody, and I thank you very much for participating with this. I serve to oversee some of the things that SkyGen we've contracted. So currently we have over 108,000 members, 70% of which are pediatric. So primarily our goals are provider engagement. That's what I'm trying to do in recruitment, identify and address better understanding and coding for reimbursement, improve access to school-based programs. Just a little tip for everybody, and I'm certain this applies with the other plans too. If you have an issue with transportation, on the back of the member's card, there is a phone number for them to call, and you can kind of facilitate that also too. So I'm going to turn this over to Billie Jean, who's going to talk more about specifics of SkyGen, who is our contractor that provides the credentialing and claims administration.
Thank you, Dr. Varon. Hi, my name is Billie Jean Hubbard. I'm the Field Provider Relations Representative. I would be your main point of contact for any need that you potentially could ever need. My contact information is listed there, both my email, my office phone number, as well as my cell phone. I did provide also the contracting email and phone number, as well as a credentialing contact for the email and phone number for them as well. If you were to need to bypass me and go directly to them to add a new provider to your group, or if you are just in general a new office. Otherwise, if you lose their information and at least have my information, you can reach out to me and I can point you in the right direction if you're confused as to who you start with. First, you would start with the state. Once you have that KMAP ID number or have added that provider to your group and got their KMAP ID number updated, then you'd reach out to us, and you can both reach out to me or customer service, contracting. Anyone can help you with pointing you in the right direction with getting the forms needed to start the process with contracting with SkyGen. Once you've completed that process, you would obviously need to register with our dental hub. It's our provider web portal, which I provided the link there. And on that, there's multiple tools. There's not only to be able to check eligibility, but submit claims, authorizations, get your provider manual, as well as your fee schedule. So there's lots of resources on there. Definitely recommend doing so if you choose to opt in to network with us. There's several ways to submit claims, authorizations. One would be also the clearinghouse, which I provided the payer ID number there, which is Scion, as well as the mailing address for claims. If you choose to submit claims, regardless of what method you do, once we receive the claims, the turnaround time is within 30 days. Generally, it's much faster. It's typically about 2 weeks, but we are given 30 days for the full turnaround process for once we receive the claim, for processing and to turn around the payment to you. So the fastest method to get claims to us, I always recommend, is the dental hub, because we can start processing it right away and we don't have to wait for claims to be submitted through a clearinghouse, as every clearinghouse has different batching out times. So I do recommend submitting claims and authorizations through the dental hub so we can start processing those right away and get them to you fastest as possible. I also recommend setting up to receive payments via EFT, which is the fastest payment method that we offer. But we do have several payment options as well, which would be virtual credit card, as well as paper check, and some others as well. I also wanted to mention that if in the event that you need to terminate for whatever reason, whether you're closing your office or retiring or moving to another state, whatever the situation is, we do require at least a 60-day notification, which can be submitted to me or any of the emails that are listed there as well, or even contacting customer service. So if there's any further questions, or if you ever need me for any reason, again, my contact information is there, and please don't hesitate to reach out to me. If not only if you're not in network, or if you are currently in network, either way is fine. Thank you so much.
Thanks, Billie Jean. And last but certainly not least is the team from United Healthcare. Christine Vandegrift is their Kansas Vendor Oversight Manager. It's all yours, Christine.
Thanks, Brian. Can you hear me?
Yes.
Okay, great. I'm excited to introduce our team and to share a little bit about what it means to be part of our provider network. And the first person I'd like to introduce is Dr. Manise. If you go back up to the other slide, just the blue one. Yep, there we go. Our dental director, Dr. Manise, she joined us in 2025, and she brings a holistic approach to our care, working to strengthen both the connection between dental and medical services for better member outcomes. So, Dr. Manise, you want to go ahead and share?
Thank you. Hello, everyone, and thanks for joining us today. As Christine said, I am Dr. Laura Manise, the Kansas Dental Director for United Healthcare. I am a licensed dentist in Kansas. I graduated from UMKC, and I have over 20 years of experience in practicing as a practicing dentist in both private practice and in public health dentistry. So I know firsthand the important work that you guys do every day in your practices and your communities. My focus is to make sure that our members have access to quality dental care and that our provider partners are supported in delivering it, as well as finding solutions to streamline processes. We have a passionate team committed to dental care, and we are excited to work with you to build strong relationships and achieve better outcomes for the communities that we serve. Thank you.
Thank you, Dr. Manise. I'd like to go ahead and advance the slide once. Thank you. So this is our provider relation concept. And you can see here, it's a map of all of Kansas with all of our counties, and it's divided. And it shows you we have 3 provider advocates, and they each have counties assigned to them so that we can build that real strong relationship in those counties with your person that's representing you with United Healthcare. So um, that approach we really think is working well for us. And I'd like to take this time to have each provider advocate get to kind of introduce themselves. And we're going to start with um, Kathy. So if Kathy, I see that you're on camera now, go ahead.
I am. Hello. Thank you for the chance to be with all of you. I am the senior provider advocate, and I have been with United Healthcare for 8.5 years. Background, I've worked in healthcare many, many years. And as far as my territory goes, if you kind of got a quick glimpse of the map, I have Johnson County, down really the state line, the Missouri state line, south to, there you go, to the end there with Cherokee. And we do, as advocates, go out. I live in Olathe, so we do have the opportunity to come out, visit with you, which we would love to do. And if any of you would like to have a visit, you can certainly let us know on this call. We'd be happy to come out or do a webinar with you to have more of a one-on-one dialogue. And the other thing is we're so proud that we have been able to be one of the original managed care organizations. We've been with CanCare since the inception, which was January of 2013. So that's it, and I will pass it on.
Thank you. Let me see if I can bring my camera back to life. There we go. All right. Thanks, Kathy. Jennifer, you want to go next?
Yes, thank you, Christine. Hello, everyone. Thank you for having us today. My name is Jennifer Martinez, and I am one of 3 advocates, and I manage 27 counties in the state of Kansas. And I live in Olathe. I have been with United Healthcare for 4 years. I have 3 decades of dental experience, which helps me understand both the provider and member perspectives and helps find solutions that make sense for everyone. Thank you for having me.
It helps if I come off mute. Thanks, Jennifer. Jennifer, Casey, you want to go ahead?
Hello, my name is Casey, and I am one of the advocates with United Healthcare for the state of Kansas. And I have the counties in the blue on the map. So most of the center and then to the west counties I have within my territory. I love going out to my offices and meeting one-on-one, face-to-face, and just helping my providers with any issues that they have, whether it be credentialing or claims. So I like forming relationships with my providers. So give me a call if you ever have any questions or need help with anything, and I'd be happy to help.
Thank you, Casey. We have one last slide, and we just put this together to give you all the information in case you wanted to reach out to them, because we're committed to supporting our providers with clear communication, timely payments, and accessible resources. So we're here to help whenever you need it. And that's our final slide. Thanks, Brian.
Okay, thanks. Thanks to all of you. This is great information. There are more technical details the MCOs will answer in future webinars. Today was a chance just to get to know them and learn how they can support your office. And with that, let's pause for a moment and see if there are any questions we can answer.
So Brian, I see one question so far. Everybody must have been doing a really good job of sharing information because I just see one question so far. And this question is actually for Healthy Blue. So I'm either Dr. Varon or Billie Jean, if you want to hop on. The question was if you all are looking at a different response system for prior authorization, mentioning that another MCO has used faxing, which worked well. So just curious about the prior authorization system.
So I'm in the process of Billie Jean. I'll let Billie Jean answer. I'm about to do an email, so I apologize. I was typing it out, but Billie Jean, go ahead and answer it. I think you can help with that. I didn't know if it was one of those options that they could select.
Sure. So we used to offer notifications via fax and mail for authorizations. We try to go electronic with our notification now. So we do it via email with the Dental Hub. However, you can always go on the Dental Hub and check status at any time on a prior authorization. And you don't even have to have the prior authorization number. You can even just search on the member's Medicaid ID number. And it would pull up all authorizations that have ever been submitted by your office or group that are currently in processing or previously processed or that have just recently processed. So you can check that status at any time. You don't have to wait for a notification to be able to get that status.
Great. Thanks, Billie Jean. I don't see any other questions. Yeah. Oh, wait, here. I spoke too soon. One person is asking if I'll just read the question. Can all three MCOs have one website for submitting claims and prior authorizations? It'd be nice to have it in a centralized location. I'm guessing the answer might be no, but I'll just toss it to kind of whoever wants to take that question.
Three different organizations have, no two will do things the same. So, so that's where I see that and stuff. I don't see that ever happening. It would be nice and convenient, but each organization is going to have its own method for administering claims.
Great, thanks. That's from Healthy Blue, obviously. Anybody, if Christine or Eric, if anybody else wants to answer that, or I can just keep going.
Let's see.
Go ahead, Eric.
So the question was the prior authorization. So we accept them three ways: clearinghouse, our website, or paper. So I think if you did use a clearinghouse, which you do not have to, I know that might kind of make it easier for you because you just use your one hub and then pick which MCO you're going to send it to. So whichever way works for you works for us. Again, but right now the options are you can submit it via paper, our website, which is very easy, or a clearinghouse at this time. So
great.
Thank you.
Yeah, thank you.
I would to add a little bit onto that. Currently, 2 of the 3 MCOs do actually utilize the same website. So UHC and Healthy Blue currently use the Dental Hub. which once you have registered your account with the Dental Hub, you would have access to be able to add any payer onto the Dental Hub. So you could add United Healthcare, you could add Healthy Blue, and there's even other payers on that Dental Hub, not just MCO Medicaid related, but there's even commercial payers that you can add. So kind of like a one-stop shop portal. So
Great. Thanks, Billie Jean. Thanks. I think it's pretty clear that everybody's learning a lot today, but also itching to get into the real nitty gritty details that we'll definitely be doing in the next 3 or 4 weeks. So this is great. I don't see any other questions right now. We've got a few minutes left if we want to talk through just a few resources. Brian, do you want to talk about a few of these here?
Sure. One of the first ones I want to mention is our website called Pathways to Oral Health. It has a blog that covers several topics like how to become a CanCare dental provider. There's various provider guidance documents on there. And then the Oral Health Kansas website also has a bunch of resources for dental providers, including frequently asked questions, enrollments, lists of codes, there's video, so lots of things on there as well. And I want to be a resource for you too. I'm here to help. You can email me at the address on the screen there, or you can call me anytime. And if I don't know the answer, I will try my best to get the answer for you as quickly as possible. And with that, I'm going to throw it back to you, Tanya.
Thanks, Brian. I'm going to go through these super fast because there was a request to go back to the screen with the payers, so I want to respect that. But I did want to just real quickly highlight a couple of other resources available. Later this week on Thursday, we're going to be launching another series of educational sessions through the University of Kansas Medical Center. It's called a Project Echo series. It's all about helping dental teams get even more confident and comfortable serving people with disabilities. There's some information here, and we will be sure and send this out if you haven't already received it. Would definitely encourage people to register for this. We did a similar series 2 years ago, and it was very well received. So we're excited to have a kind of a reprise of that. Just a couple of other quick commercials here. We do also have a dental provider advisory group that is available for any dentist or hygienist in the state who is interested in just getting together on about a quarterly basis, talking about challenges and resources. A lot of the content, even in this webinar series, came out of that provider advisory group. So anybody who's interested, we welcome you to join that group. Also, just a quick commercial. We've got at Oral Health Kansas, we have a weekly e-newsletter. Encourage people to subscribe to that because that's where you're going to find out about a lot of other resources and events that are coming up. So let me go back though to the question, which was, can we look at the payers? So you can see there, payers again are Sunflower Health Plan, Healthy Blue, and United Healthcare Community Plan. And we're again grateful for all of you for being with us this afternoon. I'm going to make your head spin by going back through the slides real quick because I'm going to say we're going to welcome them back here in a couple of weeks. We've got 4 more sessions up ahead. Next week, at the same time, we'll be talking about enrollment and credentialing. And then the week after that, on the 16th, we will be welcoming our MCO friends back to talk about some of the nitty-gritty details around filing claims. Finish it up with some Medicaid opportunities and then talking about the dental passport at the end. So hope you join us again for the remaining sessions in this series. And with that, I want to thank everybody again for joining us this afternoon, and we will see you back here next week at the same time for enrollment and credentialing. Thanks, everybody.